So what is the list of new symptoms for COVID-19?
The symptoms of COVID-19, which is the disease that's caused by the coronavirus we're all talking about, are fever, cough, shortness of breath or having trouble breathing, having chills, shaking with chills repeatedly, having muscle pains, having a headache, having a sore throat, or having trouble with your sense of taste or your sense of smell. Not everyone who gets sick with COVID-19 feels the same. Some people have no symptoms. Most people have something that feels like the flu and they can stay at home to manage their symptoms, but other people get very sick. People with mild symptoms or no symptoms at all can still infect other people. When do I know that I should go to the hospital for COVID-19 symptoms?
So if you experience any of the following, you should definitely seek medical care right away. If you are short of breath and you cannot finish a sentence, you get very short of breath when you're walking, if you have persistent pain or pressure in your chest, if you experience new confusion or inability to arouse, if you have bluish lips or face, if you can't eat or drink, if you have severe diarrhea or if you make less urine or pee, or any other symptoms that you would normally make or that would normally make you go to the hospital. If you experience any of these symptoms, please call 911 if you have an emergency. In a non-emergency case, residents of Johnson County, Iowa can call the University of Iowa Hospital at 319-384-9010. And they will make a phone appointment with a doctor to help you figure out whether or not you need to be seen in person for your symptoms. If you do not have health insurance or a regular doctor, you can contact the telemobile clinic to request a free or a webcam type medical appointment. And that number is 319-535-2684. So how do I know if I've been exposed to the coronavirus?
Often you need to be in close contact with a sick person to become infected yourself. So some examples are if you live in the same house as a sick person, or you're caring for a sick person who has COVID-19. If you're within 6 feet of a sick person or someone with COVID-19 for about 10 minutes, just being 6 feet apart, that might be enough to get you sick with COVID-19 if that person was diagnosed with COVID-19. If you're in direct contact with somebody and they cough or they sneeze on you, or you share utensils with them, or there's some other way that their saliva droplets come in direct contact with you, that's a way you can get COVID-19. If you touch something like a doorknob or a door handle, or you shake hands with something that has COVID-19 droplets on it, and then you touch your eyes or your nose or your mouth, that's a way that you could get COVID-19. COVID-19 is very contagious. Even if you do everything right, you can still get the virus. If you get sick, it does not mean you did anything wrong. It's very easy to get sick with COVID-19. What should I do if I've been near someone who was sick with a disease that might have been COVID-19, but I am not sick?
Sure. So what you want to do is watch yourself for fever or a new cough, especially if you were exposed less than 14 days ago. You can keep going to work only if you do not have any symptoms. Do not go to work if you do have symptoms, though, and call your employer right away to let them know that you're sick. How are children tolerating COVID-19?
There are relatively fewer cases of COVID-19 among children compared to adults. In general, children who get COVID-19 are tolerating the disease pretty well. Sometimes children have cold-like symptoms like a runny nose or a fever or cough. Sometimes they have vomiting and diarrhea. Almost all kids with COVID-19 will recover on their own at home, similar to recovering from a cold or flu virus. Some kids do get more sick, it's more rare. If you have concerns about your child, please contact their doctor or the University of Iowa telemedicine clinics. How can I reduce my chance of getting sick when I go to the grocery store or some other store where I go to buy something I really need?
There's a few simple steps that we always recommend that you follow when going out in public, for example, to the grocery store. First, assign one well or healthy family member to go to the grocery store. Use curbside pickup if possible. Most grocery stores and other stores have this available. Go as infrequently as possible. Try not to go very often. Go when it is less busy, when you know that there aren't going to be crowds at the store. Use sanitizing wipes to clean your shopping cart. Wash your hands or use hand sanitizer before going in. While you're in the store, do not touch your face, your eyes, your nose, your mouth. Stay 6 feet away from other people while you're there. And please wear a face covering, a cloth face covering while you're there. Use self-checkout if possible, and then wash your hands as soon as you get home. Should I wear a mask in public?
Currently, most people should wear a cloth mask when they're in a store or in a public place. Everyone wearing cloth masks will help slow the spread of the virus. Cloth masks are less effective for protecting you, though, from the virus than staying 6 feet away from the nearest person or social distancing 6 feet apart. You should continue to practice social distancing when possible, even when you're wearing a mask. Most importantly, though, when you're wearing that mask, don't touch your face if possible, and only touch your face if you have just washed your hands. So keep in mind, the front of your mask is potentially infected with viral droplets from someone else. So when you take off your mask, don't touch the front and wash your hands immediately afterward before you touch anything else. What about gloves? Should I wear gloves?
This is another great question and a lot of confusion around this one. But right now, no, you do not need to wear gloves. Your skin will protect you from COVID-19 on your hands. You must wash your hands very frequently or use hand sanitizer if you can't wash them. Again, very importantly, do not touch your face, your mouth, your nose, your eyes, and in public, clean your hands as frequently as possible when you touch something.